we're going to be talking about a very specific, incredibly effective, and, let's face it, often misunderstood medical tool, vaginal dilators. My goal today is to provide you with a safe, welcoming, and deeply informative space to really understand how this tool plays such a key role in pelvic floor physiotherapy, and how it might be exactly what your body needs to start healing. Look, before we get into the mechanics of anything, if you've been living with pelvic pain and if you have ever been told that it's just normal or that nothing can be done, or worse, that it's just part of being a woman, let me stop you right there. Pelvic pain is real. It is absolutely not in your head. I literally see it every single day in the clinic. Your experience is so valid, and most importantly, there are evidence-based treatments that actually help. Section 1. Your pain is real. Understanding your condition. Okay, let's dive into this. You may have noticed that your body has been reacting to penetration, whether that's during intimacy, medical exams, or honestly even just trying to use a tampon, with severe discomfort, guarding, or a sharp pain. Well, this is what's happening in your body, and it has a name. We use dilators to treat specific recognized conditions. These include vaginismus, which is an involuntary tightening of the vaginal muscles that makes penetration painful or sometimes even impossible. There's also dyspareunia, which is just the clinical term for painful intercourse, often caused by overactive muscles or scar tissue. We also see absolute incredible results using this tool for pelvic surgery or radiation recovery, helping to maintain flexibility after cancer treatments or hysterectomies. And finally, menopause-related vaginal atrophy, where hormonal changes lead to dryness and tightness. If any of this sounds familiar to you, stick with me because this next part really matters. Section 2. What are vaginal dilators? Demystifying the tool. Let's go ahead and strip away any stigma right now. Vaginal dilators are simply medical-grade devices. They come in gradually increasing sizes, but they aren't just about physically stretching tissue, though, yes, they do help improve vaginal elasticity. Crucially, they're used to relax the muscles and, most importantly, reframe the whole experience of insertion for your nervous system and your brain. You see, when you've experienced pelvic pain, your nervous system becomes highly sensitized. It's on high alert. Dilators help us teach the brain that insertion can actually be safe and comfortable again. Section 3. How they restore comfort. The science of healing. So how exactly do they work? Well, this brilliant little process happens in 3 main steps. First, we improve elasticity. Gradual, gentle stretching really helps restore the natural flexibility of your tissues. Second, we desensitize and reduce pain. By introducing a safe, completely controlled object, we gradually desensitize the tissue and calm down that nervous system hypersensitivity I was just mentioning. And third, we relax overactive pelvic floor muscles. Lots of people experiencing pain have tight, hypertonic muscles that sort of clamp down as a protective response. Using a dilator correctly helps to retrain those muscles to just let go and relax. So it's really all about brain and muscle retraining, never forceful stretching. Are vaginal dilators painful to use? I've got to say, this is the #1 question I get in the clinic, and it is a completely 100% understandable fear. I mean, if penetration has always hurt, why wouldn't this, right? But here is the absolute crucial point to remember. When used correctly, dilators should not cause pain. You might feel a gentle stretching sensation, maybe a little mild discomfort initially as you begin to explore a new size, but the absolute goal is gentle, gradual progress without any strain. If there's sharp pain, you stop, period. We're trying to teach your body that insertion is safe, and pushing through pain does the exact opposite of that. Section 4. Safe and correct usage, the SAFE protocol. Because not all tools are created equal, and your safety is paramount. On the safe side, you always want to look for medical-grade silicone or plastic and sets that offer a gradual range of sizing. These are smooth, they're non-toxic, and they're clinically approved. On the unsafe side, and please hear me out on this, avoid porous materials, unknown objects, or DIY methods like using candles. Do not follow advice from random online sources for this stuff. Using unapproved objects can harbor bacteria, cause infections, and seriously worsen your symptoms. So how does this actually build into a manageable routine? Well, here's the correct, safe protocol. Step 1. Find a comfortable, private, and calm space. Relaxation is essential here. Step 2. Apply a generous amount of high-quality water-based lubricant. And it is very important that you avoid glycerin-based lubricants because they can cause irritation. Step 3. Insert the dilator slowly and gently. Find a comfortable position, like lying on your back with your knees bent, and whatever you do, do not force it. Step 4. Keep it in place. Hold it there for about 5 to 15 minutes, all while practicing slow, diaphragmatic breathing. This deep breathing? That's the secret key to helping your pelvic floor muscles actively release around the dilator.
Section 5. Why expert guidance matters. You don't have to do this alone.
While dilators are an incredible tool to use at home, you really shouldn't have to navigate this whole thing alone. In fact, incorrect use on your own can sometimes kind of make things worse. At Oval Women's Health, our physiotherapists specialize in exactly this. We provide a safe, super warm, and highly specialized environment where your pain is going to be taken seriously from the very first moment you walk through our doors. See, at Oval Women's Health, we don't just hand you a product and wish you luck. Specialist care means we actually provide expert pelvic floor assessments to evaluate your specific muscle tone and identify exactly where the pain originates. We offer hands-on technique guidance, ensuring you know your correct starting size and the absolute perfect insertion method for you. We complement the dilator use with biofeedback and manual therapy to release those stubborn trigger points. And crucially, we provide emotional well-being support. Because overcoming persistent pelvic pain is a deeply emotional journey, and we're perfectly equipped to guide you safely through it. Section 6. Taking the next step. The partnership. You know, you have been patient long enough. If you've been living with this frustration, I just really want to remind you that you absolutely deserve to feel better. Specialist help exists, and getting that help doesn't have to be an intimidating thing. It literally just starts with one unhurried, completely judgment-free appointment where we just sit down, listen to your story, and chart a gentle path forward together. I want to leave you with this final thought. Your pelvic health is the foundation of your comfort, your confidence, and your overall well-being. You do not have to accept pain as your normal. If you're ready to take that first step, you can go ahead and book your consultation with us at Oval Women's Health, located in Burnaby, BC. Space is a bit limited due to high demand, but we're here and we're so ready to help you reclaim your comfort. So I just have to ask, what would your life look like if penetration was no longer a source of pain, but a return to normalcy?